Hello, my name is Indre Treciokiene. I'm a pharmacist by background and associate professor at Vilnius University, Lithuania. We welcome you to the first episode of FAP Continuous Professional Development Bite series titled Beyond Medications, Strengthening Trust, Empathy, and Loyalty in Pharmacist-Patient Interaction. This episode is focused on building trust and rapport. In this episode, we'll look at some of the principles of trust building in pharmacist-patient interaction and highlight techniques such as active listening and insightful questioning that can help establish rapport. We'll also discuss the impact of trust when supporting self-care and the management of common ailments, and reflect on how communication can strengthen trust between a patient and a pharmacist in everyday interactions. Before we begin, let's take a moment to reflect on the core human values that shape pharmacist-patient interaction. Among the many important human values, this continuous professional development Bite series focuses especially on three: trust, loyalty, and empathy. In this episode, we will focus on trust, a value that underpins every safe, respectful, and effective interaction we have with our patients. Trust is built not only through clinical knowledge, but also through the consistency, honesty, and ability to truly listen and respond to patient needs. And when viewed as covenant, the patient-pharmacist relationship compels the pharmacist to uphold the trust granted by society. As we move through these continuous professional development, right, you'll see how small communication choices, like how we ask questions or acknowledge concerns, can make a lasting impact on patient trust and outcomes. While this episode highlights trust, we also acknowledge the importance of loyalty and empathy, and these values are interconnected and mutually reinforcing in daily pharmacy practice. You can explore the other two Continuous Professional Development Bites episodes in this series, which focus on these essential human values. Throughout this episode, we'll explore why trust matters in everyday pharmacy practice, especially when managing common ailments like pain, allergies, or heartburn. And we will also look at the impact of trust on patient outcomes. Using a scenario-based approach, we'll go through some key communication techniques that pharmacists can use to build and maintain trust, highlighting the small but powerful action that can turn routine interactions into meaningful trust-building moments. We have to disclaim that the scenario presented in this video is for demonstration purposes only. It is intended to highlight selected communication and social skills in the pharmacy settings, but it does not take into account the full range of clinical and non-clinical factors that a pharmacist or a pharmacy technician must consider when conducting a comprehensive patient assessment and making appropriate recommendations. Let's consider this scenario together. Mr. Jones is a 56-year-old regular patient that comes into the pharmacy complaining of lower back pain. He appears hesitant, but asks Maria, the pharmacist, if she has anything to help manage the pain. He has tried over-the-counter medications before with limited relief. How should the pharmacist approach this patient and build trust and rapport? As we walk through this scenario, I invite you to reflect not only what would you recommend, but on how you would communicate. What would you say? How would you ask questions? What tone, body language, or words would help this patient feel understood and supported? What we are going to present to you now is a missed opportunity, a moment where Maria, the pharmacist, could have built trust with the patient, but instead the interaction failed. Let's take a look what happened. It was a busy day in the pharmacy, and Maria, like many pharmacists working in the fast-paced environments, was trying to manage multiple tasks at once. Here the patient comes in hesitant and clearly in discomfort. He explains that he had persistent lower back pain for a couple of weeks and that the medicines he had at home haven't helped. It is the moment that calls for careful listening, empathy, and individualized advice. But Maria is busy. Feeling the pressure of the day, responds quickly in a rushed tone and busy manner, offers ibuprofen and suggests seeing a doctor if the pain continues. While the advice might be appropriate, assuming that there are no contraindication or red flags, the way it was delivered lacked professional and clinical assessment of the patient's condition, as well as empathy, attention, and engagement. This interaction might have left the patient with little reassurance, no opportunity to ask further questions, and likely no sense of being genuinely supported. Before we explore more effective approach, let's reflect on the specific communication gaps in this encounter and why they matter in building trust. Let's break down what happened and see what missed opportunities were there in this case. First, there were no welcoming remarks. The patient didn't acknowledge the patient or set a tone of openness, which is critical for creating a safe, approachable environment. Second, there were no questions asked. The pharmacist made an assumption and provided a quick solution without exploring the patient's full experience or understanding what they had already tried. Pharmacists are responsible for maintaining high professional and clinical standards in their practice. There was also no active listening or follow-up, no phrases like, tell me more, or how has this been affecting you? These small action signals that we are engaged and care about the patient concerns. Importantly, there was no empathy or reassurance demonstrated through proper questioning and information gathering. Hence, there was no attempt to understand previous treatment or explore why they weren't effective. This limits our ability to give appropriate and safe advice. All of this combined likely might have left the patient feeling dismissed and unheard, the opposite of what we aim to achieve in the pharmacy practice. This brings us to an important subject on why trust and rapport are so essential in pharmacy practice. When trust is established, patients are more likely to disclose relevant information, feel comfortable participating in shared decision-making, and follow treatment recommendations. These elements are key to achieving better health outcomes, especially when managing common ailments in a community setting. Trust also plays a major role in reducing patients' anxiety and improving overall satisfaction with the care they receive. In turn, report that sense of personal connection and attentiveness helps build the foundation for long-term loyalty and continuity in care. Patients who feel respected and understood are far more likely to return and to view their pharmacy not just as a place for medicines, but as a reliable source of support and advice. These are the kinds of interaction that enhance not only the quality of care, but also the perception of pharmacy as a trusted part of the healthcare system. How can building trust and rapport with patients impact the management of common ailments and patient outcomes? Especially for minor ailments such as period pain, allergy, heartburn, trust can encourage patients to seek pharmacist advice early. Trust increases likelihood to adherence to over-the-counter medication recommendations. Trust enhances self-care outcomes and enables early detection of warning signs requiring referral. Now let's consider how this interaction, this case in the pharmacy, could have gone differently. You are welcome to pause and read the conversation at your pace. Here, the pharmacist, Maria, appears to have more of a warm tone and open body language, immediately creating a welcoming space for the patient to speak and addressing him by his name. Instead of rushing to a solution, she acknowledges the patient's discomfort and starts a series of essential questions to gain an understanding of the patient's needs. This approach not only shows empathy, but also invites the patient to share more of their story. Maria then builds on the conversation by exploring what treatments the patient had already and how effective they were. This demonstrates active listening, clinical curiosity, and respect to the patient experience. Finally, instead of giving a quick recommendation, Maria adopts a collaborative tone. Let's go over a few pain relief options together. This response reinforces the patient's role in the decision-making process, building trust, confidence, and reassurance. It's not just about the advice, it's about how we deliver it. When we take the time to listen, personalize our response, and show that we care, we don't just treat symptoms, we build relationships that lead to better care outcomes and stronger trust over time. The second scenario shows how small changes in our communication style can make a significant difference in building trust. Here are a few of the key strategies that were used. First, active listening and appropriate follow-up. Maria didn't just hear the patient, she listened attentively, asked thoughtful questions, and created space for the patient to elaborate. This shows genuine interest in the patient's experience. Second, there was clear acknowledgement of the patient's discomfort. Even a simple statement like, "That sounds really uncomfortable," validates the patient's concerns and signals empathy. Third, we see collaboration and shared decision-making. Instead of prescribing a quick solution, Maria involved patient into decision-making, building sense of partnership and mutual respect. And finally, through transparency and reassurance, the pharmacist reinforced trust. She clearly explained next steps, provided options, and made the patient feel supported and safe. All these elements supported patient in deciding with the pharmacist's recommendation on medicine. These strategies don't take extra time, but they do take awareness, and they are powerful tools in building lasting trust in pharmacist and patient relationships. Now, diving into the key elements of trust. These include competence, providing safe, effective, and evidence-based recommendations to support patient care. Confidentiality, respecting patients' privacy and ensuring the use of appropriate private spaces for consultation. Respect, recognizing each patient's or person's dignity, autonomy, and individual needs in all interactions. Communication, delivering clear, accessible information, avoiding jargon, and confirming understanding. And honesty, being transparent about professional limitations and clearly outlining next steps in care. Three important techniques are essential to use when building trust. Approachability, such as using a friendly tone and open body language, as well as having a welcoming attitude. Active listening, this includes paraphrasing and clarifying patient concerns and maintaining eye contact and holding and nodding to signal understanding. Thoughtful questioning, asking open-ended questions such as, "Can you tell me more how you feel? And what about the medicines that you've tried?" Further points to consider also include ensure transparency with regards to treatment options and expected outcomes. Ensure patient's referral to a medical practitioner is recommended when needed. Respect the patient's right to decline recommendations, and maintain professional boundaries using non-judgmental language and respectful engagement. In this scenario, what really made an effective difference to the interaction, especially within the realm of self-care and management of minor ailments, was the approach Maria used when engaging with the patient. In the missed opportunity, the interaction was rushed and dismissive. There was no empathy, no follow-up, and no effort to understand what the patient had already tried. The result? The patient likely left feeling unsupported and unheard. But when the right communication strategies were used, we saw a patient-centered and attentive approach. Maria took the time to acknowledge the patient concerns, ask meaningful questions, follow-up questions, and offer reassurance. She didn't just give advice. She involved patient in conversation, listened actively, and showed that she cared. These small, intentional strategies can have a major impact, turning a basic consultation into a trusted, respectful interaction that strengthens the patient's confidence in pharmacy care. In summary, trust leads to better communication, adherence, and health outcomes. Active listening, empathy, and transparency build stronger connections. Professionalism should be balanced with a warm, approachable manner, and respect for patients' autonomy is central to ethical communication. Finally, we would like to highlight the FIP Knowledge and Skills Reference Guide for Pharmacists Supporting Self-Care. This guide adapts the competence and behavioral statements from the WHO Self-Care Competency Framework, and it's designed to support pharmacists in developing the essential knowledge and skills needed to effectively advocate for and deliver patient-centered self-care interventions. In particular, it focuses on the competencies required to strengthen communication and share decision-making with patients, as outlined in domains 2 and 3 of this document. You can also scan the QR code to access this document or visit FIP website, selfcare.fip.org, for more information. Thank you.